It's time to turn your daydream into your dream job. Wix gives you the power to turn your passion into a moneymaker with a website that fits your unique vision and drives you towards your goals. Let your ideas flow with AI tools that guide you, but give you full control and flexibility. Manage your business from one dashboard and keep it growing with built-in marketing features. Get everything you need to turn your part-time passion into a full-time business. Go to Wix.com.
The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everybody, this is Jonathan Marks. Welcome back to another episode of Go to Health. Remember, you can subscribe to our channel at gotohealthmedia.com. That way you don't miss an episode. Today's show is about the crisis in public health. We're going to learn what public health state departments do, how they're funded, and how critical they are to maintaining good health in each state. The American Public Health Association champions optimal, equitable health and well-being for all. With their broad-based member community and 150-year perspective, they influence federal policy to improve the public's health. The American Public Health Association at APHA.org is a national movement of people, communities, and organizations working to ensure conditions where everyone has the opportunity to be healthy. Their vision is to create the healthiest nation in one generation. Our guest today, George C. Benjamin, MD, is known as one of the nation's most influential physician leaders because he speaks passionately and eloquently about the health issues having the most impact on our nation. From his first-hand experience as a physician, he knows what happens when preventive care is not available and when the healthy choice is not the easy choice. As the executive director of the American Public Health Association since 2002, he is leading the association's push to make America the healthiest nation. Dr. Benjamin is the author of more than 200 scientific articles and book chapters. His recent book, Public Health Under Siege: Improving Policy in Turbulent Times, explores the impact of policy on our nation's health and offers specific actions to improve health and extend life expectancy. So, welcome to the show today, George Benjamin. How are you?
I'm doing fine. I'm absolutely glad to be here today. Thanks for having me.
Good. Tell me why you're glad to be here.
Well, I'm always happy to talk about try to help improve the health of the public.
So tell us, what is the American Public Health Association? What do you folks do?
The American Public Health Association is an over 150-year-old organization, been around since 1872, that is a professional society of people that are interested in public health. We're a nonprofit, and we really work to both educate the public, policymakers, and to really do a lot of advocacy, craft, and shape the health policies that you see every day.
Good. I'm glad you're around. So I don't think people understand a lot about this. Tell me about state health departments. What do state health departments do?
So I've had the honor of being the state health secretary for the state of Maryland. Mm-hmm. So what I was when I was a state health officer, and this is the same for every state has one, by the way. They are a person who works in the cabinet of their governor, and they're the chief health strategist for their state. So they both serve as a health advisor on how to help their governor improve the health of the population of their state. And they also are the chief administrator for a range of programs that your tax dollars pay for, such as making sure the water is safe to drink, the air is safe to breathe, and the food is safe to eat. They serve as program deliverers, sometimes providing services, usually gap services that nobody else will do or can do. They will serve as a regulatory agency in many states. So they, for example, do such things as restaurant inspections, or at least fund some of the restaurant inspections that happen in the state, to actually, in some states, signing off on the plans to build hospitals or health centers. In some situations, they are the ones that write the regulations. So when you go to a swimming pool, there are safety regs for that swimming pool. Quite often, it's the health department that does that. And of course, if a new disease comes into the community, it's their job to, one, identify that new disease, whether it's an infectious disease or the fact that too many people are getting injured from something, and then helping craft a solution, and then working through a range of both private and sector partners to solve that problem.
That's a huge list of things that people do at the state level. Very important.
Well, I think the way to think about, health, of course, is that we're there before you're born and we're there when you die. And anything that influences your health and well-being is important to us. And I tell people that if it hurts people or kills people, it's ours.
You guys are really right in the spotlight there. Now, I understand that most state health departments get a tremendous amount of their funding from the federal level. Is that correct?
It is. On average, and there's a big range here, by the way, about half of the funding for many state health departments can actually come from the federal government. Again, some more, some less.
Mm-hmm.
And if at the local level, it can be 25, 30% comes from the federal government. But let me just give you one example. The Center for Disease Control and Prevention, the
Yes.
CDC, 70% of the money that goes to CDC goes out of the door, doesn't stay in the federal level, goes to state and local governments at the local level. So when they're cutting federal dollars, they're actually cutting your money and that you get from the federal government. Your tax dollars that go nationally, they come back to you in that form. And they provide a range of services. And then, of course, your local tax dollars then provide additional supports or wraparound services for a lot of those programs.
So these cuts that we're experiencing now in the federal budget and to the CDC, and that's really going to have a huge effect on state health departments and public health. Can you talk about that?
Sure. Let me give you an example. So just this past week, the city of Milwaukee had a lead outbreak. They had a bunch of kids that got lead exposure, and kids get picked up, with high lead levels. And of course, Milwaukee is a pretty good health department, but even a pretty sophisticated health department needs sometimes some help. And so they call the Center for Disease Control and Prevention for what we call an APHA. That means we want you to bring us some of your disease detectives, your epidemiological disease detectives with a special expertise in lead to come help us. And unfortunately, they had just laid off at the federal level the whole lead program. And so the answer was, we don't have anybody to help you, sorry.
Wow.
But normally what would have happened, as happened in Flint, Michigan, you remember the Flint, Michigan exposure?
Sure.
CDC would have come in, they've also would have brought the Environmental Protection Agency, they would have helped identify kids who were exposed to lead, they would help identify the sources, they would help come in with a remediation plan, and they would follow it along. They helped them by doing the analysis of data, and they also help being a liaison, bringing in additional federal resources, sometimes people, sometimes money, to solve the problem much quicker than you can do on your own. Another example is many of the federal laboratories serve as reference labs. Remember Zika, the Zika outbreak?
Sure.
Brand new disease, just hit our nation a few years ago. The challenge we had with Zika was every state doesn't have a Zika expert. There's a lot of places without an expert in Zika. So, but some of the world's experts are at the Center for Disease Control and Prevention. And so they can serve as experts, consultants to your state. Well, many years ago, when we had West Nile virus that hit the nation for the first time, again, no one who hadn't been out of the country had ever seen West Nile virus, but the CDC had people who had seen West Nile virus before. So we could tap their expertise locally from their national resource. So that's why it's important that we maintain that national resource as a prize value so that we can all use it when we need it.
So I just recently did a show on the cutbacks at USAID, and one of the purposes, one of the functions of USAID was to have health experts and fund health experts in different countries around the world so that we would know what's happening in the world with different diseases, outbreaks, and whatever, and we'd know before it gets here. And with the cuts in funding to USAID, we're going to lose that information and warning system.
That's correct. The best way to deal with many of these diseases is to understand them before they get here. Tragically, when COVID hit, we had seen, COVID was basically like SARS virus that we had seen in 2003.
Mm-hmm.
It was a mutation of that virus in many ways, very different in the same family of viruses, but it behaved very differently. And so learning what was happening in China was helpful for our at least initial response. Now, we didn't get it all right. China didn't share everything that they needed to share with us right away. So some places we were blind,
Mm-hmm.
but it's important that we not be blinded. So when Ebola hit the nation a few years ago, we were on top of Ebola because we had been working to address Ebola in Africa before it got here. Actually, the same thing with Zika. And you may remember that many years ago, when we had malaria, we were able to address malaria in the United States because our nation had experience with malaria in Cuba.
And so we get smart about this because the state health departments are giving us information about the diseases that are popping up in their state. And so that's where the CDC gets information about what's going on and what to do about it, correct? The state departments of health play an important role in detecting these new diseases coming in.
Yeah, all public health is local, by the way, and CDC doesn't have any mystery box with all the data. The data that CDC gives us back is actually our own data that we give them,
Yes.
and they correlate that across states so that
Right.
you can get a national picture. And then in many places, diseases don't respect geographical boundaries. So when you have diseases that cross geographical boundaries and you have two separate state or local health departments involved in that process, CDC helps to correlate that activity and then give you that information in ways that allow you to then focus your response. Because, if you have 5 cases on one side of the border and 25 cases on the other side of the border, you may be mistakenly under the impression that you don't have very many cases. But if you put those two groups of cases together, draw the geographical boundary differently, you see a very different outbreak picture than if you just look at through the lines of your state borders.
Let me ask, do the state health departments have anything to do with Medicaid and the provisioning of Medicaid, or is that a totally federal function?
So Medicaid is a state and federal partnership. And it depends on how there is an agency in every state that handles Medicaid. Sometimes it's in the state health department and sometimes it isn't. So when I was in Maryland, the Medicaid program is in the state health department. So I oversaw the traditional public health functions, as well as all of the health occupational regulatory functions, licensure functions for all the health workers, and the Medicaid program. And so the budget in Maryland was about $4.5 billion when I was there. It's grown to over $8 billion today. But the bulk of the money was on the Medicaid program.
Mm-hmm.
But the brilliance of that way that program was constructed was that I could coordinate activities both on the healthcare delivery side, where we could pay for things, and then on the public health side, where we could prevent things. And for me, it was a much more effective way for me to advise the governor and to manage health in my state.
So I'm really getting the picture here how critical state health departments are in the delivery of our health care. It's not just money coming from the federal government and raining down from Washington, but it really is functional at the state level.
We're your safety net. When you have a hurricane, tornado that tragically hits your community, it's quite often the health department that makes sure that you have portable water to drink. They do water testing to make sure that all the stuff that has, been torn up where you've had spillage in the waters, to make sure that you can actually use those waters for swimming or drinking. When you're simply going to a camp, when the environmental conditions are a certain way, particularly when there's been a lot of rain, sometimes you get very high, what we call bacterial counts in the water. And we're the ones that say, the bacterial counts are in the water, they're too high, you can't go swimming today.
Okay.
So we do a lot of things that on the proactive side that people don't know. We often say when public health does its best work, nothing happens.
Right.
And that's true. And so we don't get credit for the things that don't happen. We
Mhm.
only get credit for the things that do happen, and then we have to fix.
You are listening to Go to Health Media. To reach Jonathan Marks or his guest expert, you may send an email to jonathanmarks@gotohealthmedia.com. You may also visit and subscribe to the website and show at gotohealthmedia.com. And now, back to this week's show. So I want to, before I ask about how all these changes in federal government will affect state health, I want to ask about one more topic, which is DEI. I recently did a show on how DEI is really critical in healthcare. And I'm wondering if you can talk about the importance of DEI in healthcare and the effect that the federal government is having in rejecting this whole notion.
Yeah, we have to understand what diversity, equity, and inclusion means. They mean exactly the words. English language is a wonderful language. Diversity means that we want to make sure that everybody has an opportunity to be at the table. Because I always say, if you're not at the table, you're on the menu, right? You want to get a variety of voices. People have different life experiences. People have different economic experiences, different experiences where you live, different experiences where you went to school, how you were raised, the composition of your family. All that influences how you see the world. So to the extent we can bring people with diverse voices to the table, we have more inclusivity as part of that process. So diversity is very important. It's not just race. It's a whole range of social factors that get brought into that.
Mm-hmm.
Equity. We want people to be able to achieve optimal health. And that means that some people will need more help doing some things than others. And we should give everybody what they need when they need it. And so the idea of achieving health equity, maybe the word optimal health would be better, but that's the word we've chosen. And then, of course, inclusion is that we don't want to leave anybody out. And the idea in health is for us to go into the room and say, okay, yeah, there's a bunch of us here that are from different life experiences, so we're diverse. And yeah, we're looking at trying to give everybody what they need, but it's to ask the question, who's missing?
Mm-hmm.
Who's not been brought to the table? And if they've not been brought to the table, what's the barrier to getting them there? So I'll give you an example. We often have community meetings, and we have everybody from the community to there. It's a very diverse group of people. We're talking about what everybody needs to have. But, all of a sudden we realize we don't have any single parent moms in the room. And why is that? Well, we don't have a way to handle either the children, so we don't have a daycare for that hour or two we're meeting, or they're having trouble getting transportation. So then the question is, okay, how can we help them be included?
Mm-hmm.
Maybe it's by providing transportation. Maybe it's by having help with babysitting. So the idea is, how can we empower them so they can be part of the process? So DEI really is not designed to exclude people, which is what this administration has been using it as a way to divide us. And I always hate to question people's motives, but it's very clear to me that they're being exclusive and not inclusive as part of their thinking. We are not abandoning diversity, equity, and inclusion at the American Public Health Association.
Good.
We're just not.
Good.
So we think strongly in that concept.
Yeah, you really outlined how DEI is really about inclusion, and it's not about reverse discrimination. It's about making sure that everybody's included and has a voice at the table and can get equal access to healthcare and the best health outcomes that we can achieve with them.
That's right. No question about that.
So before we go on, I just want to remind everybody that we're talking to Georges Benjamin. He's the executive director of the American Public Health Association, and he's been there for quite a while and came from the state of Maryland, where he was involved in public health in the state of Maryland. So Georges, what are going to be the effects of all these cutbacks that we're seeing this past week in federal funding?
It's going to devastate the nation's public health system. We only spend about 3% of our healthcare dollar on public health. We spend, as a nation, $5 trillion, private and public, on health in our nation. And yet only about 3% of that or so is on the prevention wellness side of the equation. And so they're taking the money from the part that really has the best buy, that the part that actually does the most to prevent you from getting sick in the first place. I spent the first half of my time in medicine as an emergency physician. And so I've seen what happens when the healthy choice isn't the easy choice, when people end up injured or sick. So I see what happens on the expensive side of medicine. Wouldn't it be better if we can prevent these things from happening in the first place? And we have a lot of science, so we understand why that happens. So we're concerned about that. I think the other thing is they're truly trying to do these cuts so that they can, not because they've got some grand design on how to improve the health of America. They're doing this to get money for tax cut.
Mm-hmm.
You know, they're trying to find money everywhere as they can. And they're doing it in a way that is, I believe, sloppy. Every time they do something, they then figure out, oh, we shouldn't have fired these people because they do this. They shouldn't have done that. If I ran my business like that, my board would fire me.
Mm-hmm.
So I think that's the problem. Everybody believes that anything can be made more efficient. While as a nation, we spend twice as much as the other industrialized nations on health. That's true. We are still got a pretty good record of health. In other words, everybody wants to come here to get their health care if they get sick, right? So it's not that. We know what we need to do to improve our rankings with other industrialized nations. Number one, we need to get a system with everyone in and no one out. I'm not speaking on single payer per se. I'm just saying, like many other nations, we need to get a system that says everybody has health care and doesn't ration based on how much money you have in your pocket, which is how we do it today.
Mm-hmm.
Secondly, we need to promote more primary care. Other nations that have improved their health status have much better primary care and more emphasis on primary care. Cuba, interestingly enough, is an example of a phenomenal primary care system, despite the enormous poverty that they have there.
Hmm.
Third, we have a fractured system. Our payment systems are fractured. Our delivery systems are fractured. When we have the most problems in our healthcare system, it's always the handoff between system A and system B. And about 20% of our costs in health have been deemed as administrative. Some of that would be waste. You know, in other industries, banking has gotten the costs for the exchange and moving your money around to darn near zero. Medical care is still spending 18 to 20% of your healthcare dollar moving money around, fighting over who's paying for this and who's paying for that. So we have a lot of opportunities for savings on the administrative side of medicine. And then finally, 80% of what makes you healthy occurs outside the doctor's office. It's access to education, transportation, safe, affordable foods, a place to live that's safe. If you think about what you do in any 24-hour day, there are a lot of opportunities for you to become healthy, and a lot of opportunities for you to become ill or sick. And so we, unlike other nations, we spend much less of our healthcare dollar on social services. We spend it on sick care versus making sure people have access to a good retirement system and social services and things like that. If we did those things, we would rise much higher on the rankings than compared to other industrialized nations.
Thank you for that. It's really great insight about how we can do things better. And we're acknowledging that we're not perfect. We can get better, but these wholesale cuts that are coming through, as you're saying, and I completely agree, they're foolish because they're supposed to be saving money, but they're actually going to cost us more money with poorer health and poorer outcomes.
Poor health, later state of disease, at a higher cost.
Yeah, got it. So how do we respond to all this? I know the APHA, and let me just share that website with everybody, the American Public Health Association. It's apha.org. You can go there to learn more. So what should we be doing now in the face of all these cutbacks and loss of control?
Well, we have to remember that this nation was always designed to be by the people, for the people, right? So we actually do have control. Our elected leaders work for us. So that's the first thing you have to know. And we've said that first, make these folks follow the law. That's why we have these rules and regulations. Make sure that they're following the law. And they're often kind of just doing stuff and they're not following their own processes in the law. Secondly, there's a lot of things happening very quickly. And I think it's important not to chase the shiny thing. So I think that they're doing a lot of things very quickly. And I think it's important for us not to chase the shiny things. What I mean by that is there are some things that are very important and there's some things that are not so important. My environmental folks really care about the decision not to go from paper straws back to plastic straws. They think that's terrible, terrible. But that's probably not an important issue. What is important is firing people indiscriminately, big budget cuts without any thought. So we're focusing on those big things. So we're encouraging people to focus on the big things that are happening with the left hand so that you're not paying attention what the right hand is doing, And I think that it's important that people pay attention to the big, most impactful things in their lives. I think the third thing, of course, is to tell people who's responsible for that and then hold our elected leaders accountable for it. That means going to town hall meetings. That means writing letters to them. Tell them what you care about. Every administration thinks that they have a mandate, and every administration at some point overreaches. And I think that's what's happening now. And I think that we as the public, if we are silent, then we're complacent. So when they're doing things that we don't think are right, even if they're, I don't agree with things. I have disagreements in my own family about policies and things like that. And it's okay. It's okay for us to disagree, but we need to speak up. So whether you are far right, far left, center of the road, I encourage you, no matter who you are, to speak up, because at the end of the day, if we cannot have a dialogue amongst ourselves, tell people how we really feel without bad-mouthing each other, without condemning each other, treating each other with respect, and have that conversation. And I often will seek out people who I vigorously disagree with. I have meetings, breakfasts, side conversations all the time with people who I think in general, their heart in the right place, but I disagree with how they want to get there.
Right.
And we talk about it. And sometimes we find, boy, we don't really disagree as much as we want. And sometimes we end up compromising, and that's okay.
But at least the realities are out there. They're spoken, they're talked about, there's discussion, there's communication,
Yes.
And we get to a point where we can all live with something.
Absolutely. And, I'm learning more and more to zip up my mouth and open up my ears and spend more time listening. So you see all these town halls these elected officials are having?
Yes.
I think they would have been better off getting off the stage, sitting in the room with a half circle, letting people get up and tell me what you think, all right? Hearing what people have to say, and then contemplating an intelligent response, and then answering their questions. I think that would have been a much more better way to do a town hall. I can tell you, look, in my many years of public health, I've been in some town hall meetings with some very angry constituents where we've cut funding for things. Budget cuts didn't allow me to do things I wanted to do, where a decision was made by somebody that I didn't agree with, but they're my boss. And by the way, I've made decisions that people didn't agree with. And I've gone in those meetings, but I've always set up the ground rules in a way that we had a respectful meeting, that I could listen to what people said to me. We all say things that we wish we hadn't said. When you do that, acknowledge it, apologize for it, and move on.
Got it. Georges C. Benjamin, MD, thank you so much for being with us today. You've done what I wanted, which is to really elucidate for people what the role of state health organizations are. And the American Public Health Association works to keep the public healthy. Thanks so much for being with us today, Georges. I really appreciate it.
I'm glad I could be here.
Good. Thank you, everybody, for watching. Hope you've enjoyed the show. Hope you're learning a lot about how our health system works. And Georges has helped us do that today. Remember to subscribe to us at gotohealthmedia.com so you don't miss a show. And as we say at the end of every show, remember, go to health. Thanks for being with us. We'll see you again next time. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.
Running a business can be exhausting. Building your website shouldn't be. With Wix, you can express your ideas, give direction, then leave the heavy lifting to AI, from site creation to branded content and images. Have fun with the details. Customize what you want the way you want, and manage your whole business from a centralized dashboard with expert AI tools. Build, scale, and enjoy the incredible results. You can do it all yourself on Wix.